Cook Children's Medical Center is blessed with some very good nursing staff. And the 5th floor of the medical center is a place that I work all the time. And this was a weekend, I was making rounds, and the nursing staff there noticed a pattern that we had several young infants with pertussis, and that their birthdays were clustered around a relatively small bracket of time. And they just said, you know, this is funny. What do you think about this? And that started this whole process. So I think we need to credit the nursing staff here with recognizing something that was a critical observation.
Our role in the laboratory during that outbreak was to initially to diagnose the infections in the newborns by a rapid diagnostic test that allows us to get a reliable answer within about 24-hour period. So we were much more quickly able to diagnose the infections, and once we recognized that these infants were born at the same community hospital, we were able to work with them closely in testing additional babies that were born there, as well as their families and healthcare workers that might have been involved in the outbreak.
Within a week, in conjunction with the birth hospital and the Tarrant County Health Department, they determined where the source was and treated her and took her off work for a few days and brought in as many babies as they could that she had taken care of within a certain period of time and treated them as well. Several had already been admitted to Cook Children's and were cared for at Cook Children's either through the emergency room, or most of them were inpatients either on the unit or in the pediatric intensive care unit.
The full impact of this wasn't evident initially. You really needed to do a research project to study it and to systematically look for all the kids that were affected.
When I did a retrospective look back at all the records of the infants who were born at this birth hospital and all the ones that the particular employee had cared for, and then all of the pertussis cases that we had admitted here or seen in the emergency room, we had determined that at least 11 newborn infants had been infected by this particular healthcare worker who had a fairly mild case of pertussis, which would have gone under the radar screen and probably does on an everyday basis elsewhere in the country. But it did highlight the fact that just brief contact with the very susceptible newborn infants can cause infection in these newborn infants, and infants less than a month old are highly susceptible to death from pertussis as well, so it's very important to protect them.
This event was something that said, here's a situation that's serious, and it's a place where you can actually do something. You can immunize people and you can protect babies when you do it.
This research was important to highlight the fact that it is possible for this type of infection, pertussis in this case, to be transmitted by healthcare workers to a susceptible population that has not been vaccinated, so their immune system could not fight off this type of infection.
One thing is, I think if you're involved in medicine and laboratory science and administrative work, we always try to do a better job as we move through our careers. And if you do research, usually you ask interesting questions. You have to see what other people have done, and you have to look at what you do rigorously and try to improve it. So, whenever we have a challenging problem, research is one of the ways that we can improve ourselves.
I know that my cohorts, Don Murphey and Jim Dunn, I know that every day we do things because they're the right things to do and not because we're published and we get to put that on our CV or because we get to do media interviews and things like that. It's because it's the right thing.
It's important for us to do this type of research here at Cook Children's so that we can further the wellness of the kids that we serve in this area. And I think by highlighting this outbreak situation, there's a greater awareness of this type of infection in the community, and in general I think it's going to serve the wellness of the kids in our area.